Welcome to Twins World, all about parenting, and we are having a good time because God is taking us to a different take. And this week we are going to talk about the brushing in children. So toddler is the time period where we are introducing the brushing concept. Even though the brushing can be started in the newborn time by the mother with a finger dipped in boiled cool water, so that whatever patches has been on the tongue because of continuous drinking the breast milk can be removed by swiping away the tongue and the cheeks and the gums. So this way you can clean the mouth because the baby is bringing milk in and out of the day. So this helps you to clean the mouth. Whereas the child grows more, that is, as the complementary feeding starts from the 6 months, we need to understand that the brushing is also an important concept. But the brushing can actually start with a soft brush by 12 months. When the child starts having the one teeth or two teeth other than the finger, we can go for a finger brush, whereas with the finger brush which is introduced into the finger and we can clean it. So the concept of brushing with a brush starts from 1 year, as I said, and the toothpaste can be used by 1.5 years of age. Before that, what we can use with the boiled cool water, you can brush the whatever teeth available on the mouth of the child. And it is always good that we teach them to brush twice a day. And we know that there are so many nursery rhymes and children's songs to make them brush because it is an activity that we need to inculcate into the life of the children. So the things we need to understand that when the mother or the caretaker is brushing the teeth, if the technique is not correct, it will actually make the gums swallow and become reddened and it starts bleeding. So it's very important that when we brush the children, it should be of correct technique. And if it is not done in a proper way, in a lazy manner, what is happening, we can see a white plaque-like structure over the teeth which can destroy and the child can come up with dental caries. If the child is less than 3 years, we are advising you to have a grain size amount of toothpaste to brush, and if the child is more than 3 years, we can go into a pea size the toothpaste can be used. That means the amount of the toothpaste can be reduced. And as we know that we should not use the adult toothpaste, there are toothpaste, because the quantity of the fluoride content of these toothpaste will differ, and if the fluoride content is more, it can affect the enamel of the children. So the next thing what we need to understand that we need to make the child sit in on our lap facing towards a mirror so that you can also see what is happening with the child, and make sure that the child is opening the entire mouth in front of you so that you can see that the entire mouth while you're brushing the child. And now there are different simple techniques we can adopt to have a good brushing, so that we are also sure and we are teaching them what are the techniques of brushing. While you're making the child to sit on your lap, always make sure that the head of the child is tilted towards your chest so that you can also tilt forward and see their entire mouth when we are going to brush the teeth of the children. Next, what we can do is we can angle the bristles towards the gum so that whatever food particles inside the mouth can be removed. Later, go in little circular manner so that the entire teeth and all the corners of the teeth can be cleaned while you are brushing the teeth. Brush backward and forward all the surfaces where you are chewing so that whatever food particles on the curves of the teeth have can be removed. So this way we are able to clean all the aspects of the teeth. And once the brushing is over, encourage the child to spit. We can always see that the child is eating the paste. That's why the selection of the toothpaste for children is very mandatory, because it helps to, even though the child eats that particular paste also, it won't affect the child. As days goes by, we need to teach the child to spit so that they are able to take out whatever dirt is coming in the mouth and spit it out. And we need to teach them how to rinse the mouth with the water what we are giving, and we can expect the child to drink all the water we are giving. So always give them drinking water, so if it is going inside also, we are not introducing any kind of infection to the child. And once the rinsing of the mouth is done, it's always good with the hands you are cleaning the gums of the child and the tongue and the inner aspect of the cheeks, so that more than brushing with hands, you are swiping out if any extra dirt is there. So this way we can complete the process of brushing. And it's always good to have a morning and evening schedule so that we can take them to an adult path of brushing sense. One of the main complication if the brushing is not good in children is dental caries, which is very quite common in almost every children. If we know what is dental caries, it is the breakage of the enamel or the decay of the enamel of our teeth, and as we know that enamel is the whiter outer coating of the teeth what we have. So what is happening that when the child is eating the food, what if we eat also, there is food particles remaining in our teeth. So this food particles can bring bacteria, and the acidic nature of the bacteria protection as well as the saliva and the food particles can bring a substance called plaque, and this plaque will destroy the enamel of the teeth. This is the basic the cause of having a dental caries in a child. And dental caries is mainly seen in children who's having a practice of having bottled milk in the night, and the mother is also comfortable that the child is keeping the bottle of milk in the mouth and sleeping. So what happens, the milk or any food particles that is there left over in the mouth throughout the night will give a culture area for this bacteria to grow up and start with dental caries. And I would say it is a major defect of the parents or the caretaker that the child is coming up with the dental caries. So one of the preventive measures what we can do is try to make them eat food earlier, and once they are eating food, every time when they eat, give them more water so that it can take away water food particles left, and after that rinse their mouth 2 to 3 times so that whatever is left over can be again removed out, and keep a habit of brushing in the morning and evening so that this can be avoided. And also it's always good to have a dental follow-up or checkup whenever you go for an immunization or a follow up with doctor for any reasons, so that any kind of initial startage of dental caries can be identified and we can remove it in children. And how we can identify this dental caries is we can see white dot on the teeth. More than that, the child may complain of pain in the teeth, as well as whenever they eat little hot or cold food, they will see that sharp pain, which is known as the sensitivity of the tooth, can be seen in children, which again end up in further procedure of removing the teeth or filling up the teeth or root canal, which leads into much financial issues as well as complication in children. So in order to avoid these small things in children, it's always the parents need to buck up and prepare themselves to teach the good brushing techniques so that we can avoid this kind of complication. Hope this session is good enough to understand the brushing techniques in children, and we can bring them in better, healthier way. Thank you.